My name is Dr. Jim Haley, and a little bit about myself. I have been married to a wonderful woman, Lisa, for 30 years, and I have two incredible kids, Ryan and Lindsay. We had to figure out where do we want to live and practice, so we looked around, and that brought us to Rome, Georgia. We were there for about 20 years, and as of 2012, now I'm in Canton and have been a part of Cherokee Women's during that time. As far as what I like to do, of course I love spending time with my family. That's number one. And but a little bit more specific as far as myself, I love to do what I consider a challenge. It just speaks to me. And so this started years ago. I started running, which over time then led to marathons, and from marathons that led to triathlons. From triathlon went into Ironman triathlons. After that went into ultra distance running, and following that into obstacle racing, which I'm now doing things like Spartan. So again, if it's a challenge, then a lot of times that's what I want to do. I think that had a lot to do as well with why I chose the field that I went into, and to become a doctor in general. That it's certainly a challenge, and so I was attracted to that. I've been asked many times what made me want to be a doctor. I don't have a specific answer to that, although it seems like even back as far as when I was a teenager, it was just something that I knew I would do. I don't know why, but then what led me to be an OBGYN. In medical school, we spend time in the different rotations, and that allows us to get a taste of the different fields that are out there. So my first experience was in surgery. I knew that I wanted to do surgery of some sort, just didn't know what. And then from there, my second rotation actually was in OBGYN, and that did it. I think probably like a lot of my colleagues, when I experienced my first delivery, I was absolutely blown away. I even went home and I was laughing, telling my wife, because it was just so unbelievable to me to have witnessed that, to be a part of that. So that really attracted me to it. The other aspects, though, of the field were also very, very appealing, not just the obstetrical part, the gynecology part, the surgery part. So all of that really spoke to me, and but after that rotation, it clicked. I knew that's what I wanted to do. Well, I think probably first and foremost, just being able to witness the miracle of life, that's extremely special, and to be a part of that, that's a gift. I also love working with women over time, developing long-term relationships with them and helping them through all the phases of their life. That means a lot. The aspect of surgery and the special type of surgeries that I do are also, they're quite challenging. That's again part of the appeal. The female pelvis, a lot of people don't know, but it is actually one of the most, if not the most complex area within the human body to work and to understand. There's a couple of us who do quite advanced surgery. There's not many gynecologists within the country that do all of what we do, and so there's that attraction, that challenge of the expertise that's required, and that's something that we continually have to improve on, always trying to make outcomes better and make what we do better. I want to give women the most optimal care I can and the most compassionate care to meet their needs and concerns. And then when it comes to surgery, which is my primary focus in my area here, I want to always strive for excellence and the best possible outcome. I know that God has placed me in a very unique position, and He has equipped me with skills to help women. So with great humility, I just try to do the best that I can in the role that I'm in. I was mentioning surgery, a little bit more specifically to that. I'm double board certified both in obstetrics and gynecology, and then in also what's called FPMRS, also known as urogynecology. And what that is advanced reconstructive pelvic surgery, and then cosmetic gynecology. Let me explain a little bit more about what that encompasses. When talking about advanced pelvic surgery, this is a wide array of things, anywhere from loss of bladder support, loss of support for the uterus, the vagina, problems with support around the rectum, any of those things, urinary incontinence. And then when talking about cosmetic gynecology, there are other terms that people may be familiar with, such as vaginoplasty, vaginal rejuvenation, those types of things. So all of that, the different aspects of surgery. And then I also do a fair amount of menopausal management and hormone replacement therapy. Well, I do want to conclude by saying thank you for your attention and for watching this. There are many, many women out there who are suffering in a lot of different ways, so they have a lot of concerns. They don't know what might be going on. They may not know what's available to them. That's what I'm here for. So if you have any concerns, any questions about anything like this, and you want to talk about it, please call my office, come in and see me. I'll sit down with you, we'll go over your history, do your exam, and then I'll tell you what's going on, and then we can explore how to make things better, how to make your life better. So if I can help you in any way, certainly call, and look forward to seeing you. So thanks again, and take care.